I'm intrigued by this next presenter. I wonder, talked a lot about sort of mega trends today, and there are some consistent themes, I think, throughout the presenters, both the conference overall and this afternoon. But I wonder if we aren't on the cusp of a significant change in thinking regarding lifestyle habits and their impact on health. For years, when you looked at big payers' wellness programs, they were couched more on the premise of this is an employee benefit or this is for retention. They didn't really expect to get an ROI from it, right? Because by the time you prevented, spent all this money, made all this investment in getting your employees healthy, they were either working for someone else or Medicare's problem by the time disease manifests itself. But I wonder if, but now, as Todd Park and others have sort of said, you know, you get healthcare payers, insurance plans, self-insureds showing up at Health 2.0 and other forums for the first time. You know, what's that about? And I wonder if part of what's it about is also sort of an underlying current in the medical community that says that healthy lifestyle is not just preventative, it's therapeutic. So guys like Dean Ornish, who now have a CPT-4 code for a lifestyle program of which nutrition is a significant plank, is is an important part of that. Seminal works like Michael Gerson's, The Second Brain, that talked about the importance of, your gut has a mind of its own, right? The importance of your digestive system and metabolism to just the way you think, your emotions, and overall health. So our next presenter, who I'll ask to join us, Alaina Hanlon, founded PhenotypeIT around some of these issues. She was the winner of the, I hope I get this right because there's a lot of categories, the Healthy People 2020 component of the Health 2.0 challenge in the nutrition and fitness category. So with that, I'll hand it to you. Thanks very much.
Great. Thank you very much. All right, good afternoon, everyone. Thank you for being here. So, yeah, I think we are on the cusp of something really happening in healthcare with prevention, and we've seen a lot around nutrition and the key role that nutrition plays in preventing some of the leading chronic diseases facing our country, and that's type 2 diabetes, heart disease, obesity, metabolic syndrome. And what we've done at Phenotype is we've developed out a platform for, it really is a targeted lifestyle intervention program with a large focus on nutrition, clinically backed nutrition programs for helping individuals to make healthier choices, kind of reveal what are the behaviors that I'm doing in my life right now and how is that impacting my health. You might be wondering, what does PhenotypeIT mean? Well, you might be familiar with genotyping and genes and how our genes play a role in what chronic diseases we might have. But the other side is phenotyping, and that's the lifestyle, environment, behavior, all the things we do in our day-to-day life that are putting ourselves at risk for these chronic diseases. And the diseases that we're looking at with diabetes, heart disease, obesity, metabolic syndrome, these diseases are preventable. So we've developed out this targeted lifestyle intervention program where we help guide individuals to make healthier choices. And then right now we're working with employers and health insurance companies as part of a kind of a corporate wellness initiative to make the employees healthier and reduce the overall healthcare costs. So the other side of the platform, one side of the platform is for the individuals to engage with, and the other side is pulling together all of that data and providing an analytics suite for the program sponsor to see where they should, what does the health profile look like of their population? How should they be structuring their programs, their incentive programs based on the direct needs of their population, and then being able to see the overall program effectiveness. So we'll attempt to do a live demo of both sides, and first we'll start with what an employee or what a member would engage with in the system. So PhitMe, PhitMe, is the portal that the individual would engage with. So when they first log on, they're presented with, this is their personalized homepage here. Now when they first log on, the banner at the top kind of just presents the whole program to them. What is this all about? Why should I care about this? And then moving down, we have this action plan here. And this is a personalized action plan. This is kind of the go-to spot for the individual. It's a step-by-step, almost a to-do list of these are the top things that I should be doing as an individual to help improve my health. It's personalized based on their clinical needs, on their goals, their preferences, their readiness to make a change. Change is really hard, and so we're taking a very slow, gradual approach to help the individuals make improvements that are important to them. So first we need to see what is the health of the individual. Are there any chronic diseases, any risks? What's the starting point from a health perspective? So the first setup step is to guide the individual to their health report card. We've developed out our own health assessments called the Fit 20. We've narrowed down some of the more cumbersome health risk assessments that are out there. We've kind of trimmed it down to a real quick 20-question assessment, which is needed to run our analytics. We have a lot of analytics behind the scenes to run the risk profile. A lot of the medicine behind our technology comes from Massachusetts General Hospital and the Center for Nutritional Metabolism there, who the other co-founder is a part of. So we can also pull in data from other third-party sources. So we're trying to make this really easy for the individual so they're not just grueling going through all these data entry forms. So if the data is available, we can pull it in. We're also pulling in biometric information. So we pull in that data and we run a full risk profile. And you can see here the top of the report card, might be hard to see, but the top shows a 10-year risk of type 2 diabetes, heart disease, metabolic syndrome, and osteoporosis. And then moving down the report card are all of the modifiable factors. So all these risk factors that are putting the individual at that elevated risk. And we show the data several ways. We show what their numbers are, where their goals are, and then we have some nice dials to show where they fall in a kind of in the spectrum. And this is a completely dynamic report card. So as they're using the system, tracking their weight, using all the nutrition tools, and really engaging with it, all of the risk is automatically updated, and these dials all change in real time so that they can see their progress. And then give some feedback on lifestyle. So that's kind of the starting point from a clinical perspective. That sets a lot of the parameters behind the scene for what the clinical needs are. And now the next step, as I said, the key role that nutrition plays, we kind of need to see what's the starting point with nutrition? What are the current behaviors, and how might their nutrition behaviors be impacting their health? So we've developed out this nutrition assessment. Basically, it's a 24-hour recall where the individual can enter in what they eat. And then we run a full nutrition analysis. Moving forward, we're looking into some more innovative, really easy ways to enter in food, like taking pictures and stuff like that, scanning UPC. So again, we're trying to make this as easy as possible for the individual to enter in these foods. So once we then assign a score. So we're running a nutrition analysis on this. Then the individual receives a personalized nutrition score. And this score here is looking at the quality of the food they're eating and the quantity. So it's not just about calories, but it's about micronutrients, about sodium levels. So if this individual we saw had a risk of diabetes, well, there are certain nutrients that need to be regulated. And if you eat those in excess or something's not enough, it's going to directly relate to that impact, that increase in disease risk. So this score is completely personalized to each and every individual based on their unique disease state or risk levels. So in essence, this nutrition score serves as a really nice number to focus on for the individual. By increasing your nutrition score, you're improving the biometric values and ultimately reducing overall disease risk. So it's a nice number to focus on. And a lot of the program moving forward guides the individual to how to make improvements in that nutrition score. And then we see some dials on, whether or not they're over or under in their calories. And again, we provide a lot of feedback on how to improve that. Now this here, you might be familiar with the USDA shifted away from the pyramid and now into the choose my plate with all of the food groups. And this plate here on the right is the kind of the ideal balance. And these are all the food groups here. So it's fruit, vegetables, grains, proteins, dairy, oils and fats, and then the discretionary, the dessert type foods. So what we've done is we've taken it a step further and we've personalized the plate here on the left. This is what the individual recorded eating. So they can click on any of these food groups here and see how they did. And now all of these over time are, the individual can see how they're doing. The goal is to get the plate on the left to match the plate on the right and get that nutrition score up. And again, the whole program works with them of really guiding through how to make that happen. All right, so that was, and the individual can use these food diaries every day and then get a nutrition score every day and just it's all tied together to improving their clinical need. And then we guide the individual further to set goals, like setting a weight plan that helps set the calorie level. Now moving forward, this action plan update. So we're just seeing here a new user, but tomorrow and then the next day moving on and on, that action plan updates to guide them. So this month, let's focus on, they weren't eating any vegetables, let's focus on introducing some vegetables. Start real small, small little behavior changes, and then the action plan updates for things to stock in your pantry. So a lot of times we work with people and, okay, I was just diagnosed, I'm at risk for diabetes, I don't even know where to start. So guiding them through, these are some things to stock in your pantry. This is where you can find it on sale near you. Here's where how you can make it into recipes. So really guiding the individual at the point of decision to help make healthier decisions. So quickly, I'll just show a couple more of the tools that we have for the individual, and then we'll flip over and look at some of the analytics. So we also have meal planning tools. So you can see here that, so this is a daily menu planner that the individual can use if they really want kind of a regimented approach of, I don't know how I should be eating for my disease risk. We guide through, we have a database full of meals and menus, and these are completely personalized to their clinic needs. So we can see here that this diet that we're showing here, or this meal plan, satisfies for diabetes, heart healthy, metabolic syndrome. It's all put into one. So all the nutrition parameters are set for them, and their calorie goal. So if they don't like some of these, I don't like oat bran bagels, so you can just show new breakfast and kind of play a little meal roulette and build your own type of menu. So if anything, it's just a guide to this is what healthy meals look like. And these can all be added to a shopping list and linked to recipes and all of that. And then we have health trackers. So the individual can track their weight over time. And again, all of these are linked to, we pull in all of that data anytime they track something, and it reassesses their risks and updates their action plan based on their preferences and everything. Okay, so I will sign out here and then sign in as a program sponsor, and we can look at some of the analytics. So if this is in an employment setting, an administrator of this program wants to say, okay, what does the population look like? How should I be structuring my programs? I didn't point out, but you might see on the action plan that there were those points next to each action, and those can link into an incentive program, which is really critical for keeping engagement, especially in the employment setting. Incentives are a really big role. So here, as an administrator, we can see, all right, this is a nice high-level view of what the health risk profile looks like of the population. So we're seeing these are the top diseases: diabetes, metabolic syndrome, heart disease, and osteoporosis. And the size of these quadrants is driven by the prevalence of that disease within the population. And then all of the boxes within here are the leading modifiable risk factors. So we can look at this data several ways and say, okay, my population, there's a really big problem in these areas here with blood pressure, overweight, cholesterol. Nutrition addresses all of these. So with our nutrition program, they can really be incentivizing and promoting those programs within the organization, and we will see these numbers come down. So then all of these, this high-level report can be drilled into so that we can see at a more fine-grained area, a more fine-grained view of these risk factors. And all of this trends over time, so we can see, day one, how we started, and then with the engagement, so we can see the overall program effectiveness and, be able to demonstrate the return on investment of these types of programs. All right, so we're getting close to the end, so I want to open it up to any questions if anyone has any. All right, well, thank you very much for your time and your attention.
Thank you very much.
Thank you.